So this is the patient. We have a 35-year-old female. The patient has what? Disorganized thought process, right? Hallucination, delusion, and catatonic features. What do you think is going on with this patient? A 35-year-old, disorganized thought process, hallucination, delusion, and catatonic features on assessment. This is what the provider found, right? Patient is planning a trip to space. That's what they tell you, right? The patient said, I'm busy. I cannot take care of myself. This is why, because I'm planning for a trip to space, something should be ringing in your ear. The patients smell and they are disheveled with unkept appearance. This should give you a clue. When you read case studies, these are what we call buzzwords. So a 35-year-old, disorganized thought process, hallucination, catatonic features, delusion, and they're planning a trip to space. Does that make sense to you? And they're busy, therefore they cannot take care of themselves. They smell, disheveled, and unkept. If you read this question, as number one question on your NCLEX as a case study, what do you think is going on with this patient? 35-year-old, disorganized thought process, hallucination, delusion, catatonic features, and this is what they're telling you. What do you think? What is your diagnosis? What psychological mental health diagnosis will you give this patient? You have an option. Do you think is what? That's the differential diagnosis. Is this depression or bipolar? Is this patient has hallucination or delusion? He's 35. Disorganized thought process, hallucination. All the thought process is affected. Patient has disheveled appearance. 4 options. What do you think is going on with the patient? All the answers are in the statement I gave you. If you know the answer, you can put it down. But you can tell that the presence of delusion, the presence of hallucination, presence of disorganized thought, and the presence of catatonic features is a diagnosis of schizophrenia. It cannot be depression because it does not meet all the criteria for a depression. You have to have hopelessness. I did not give it to you. You have to have like weight gain, sleeping problem. There's no, we call it psychic. You don't see that. A bipolar, what do you expect? You expect things to go up. They are not unkept, basically malnourished. They won't eat. They won't take care of themselves in that way. They're not planning a trip towards space. They don't have hallucination. They will have grandiosity, basically elevate themselves, but they don't have the signs of what? Delusional thoughts that I talk about, right? It can be delusion because delusion is a fixed thought. This was not a fixed thought. Yes, all the features. And therefore, what features was listed in the case that indicates that this patient has positive and negative symptoms? What do you think? You can list them in your comment, but what do you think are the positive and negative symptoms that we use to diagnose the patient? Right? Disorganized thought, is it one of them? Delusion, is it one of them? Right? Hallucination, is it one of them? Catatonic features, is it one of them? And if so, distinguish between them, whether one is positive or negative. Which symptoms are positive and which symptoms are negative? Based on the initial presentation that I gave you, this is the patient, right? Disorganized thought process, hallucination, delusion, catatonic features, is planning a trip to space, busy, cannot take care of themselves, and they smell disheveled and unkept. Which one are positive, which one are negative, and which one you should worry about? So let me know what you think. Which one are the positive symptoms, which one is negative? Nursing school usually love it is this, because what? They are used to make a diagnosis. You have to have a positive sign and then a negative sign. The positive sign are the keys diagnosis of schizophrenia, which are what? Hallucination, right? Delusion, and the disorganized thoughts. Those are the clear symptoms of what? Positive signs. The negative signs are what we call depressive symptoms. Catatonic is the severe form of depressive symptoms where the patient does not move, they stay one place, and they basically very negative in every situation. So those are negative symptoms. I want you to master these 5 A's. There's a bunch of A's associated with the negative symptoms. Understand what is anhedonia means. Understand what allogia means. You have to know what avolition means. You have to know what apathy means. Apathy, basically. These are all the sciences, A's that usually shows up in the NCLEX or nursing school. So no, anhedonia, basically lack of pressure. They don't have pleasure to do anything, lack of pleasure to do anything. Allogia is a paucity of speech. Basically, they don't want to talk. They're very quiet, right? Anhedonia, basically, like I said, it's a pleasure, but avolition is energy, lack of energy, and apathy is just emotional aspect of it. So those are the A's you should focus on when they can ask you to explain it. We talk about the cognitive dysfunction, right? These are the impairment, memory impairment. They may have deficit issue and they can't think properly. But these are the way you can diagnose schizophrenia patient. And when they give you a case study, pay attention to that. Now, what do you think we should do? What is your priority action for this? If you're taking care of this patient or you see this in class and they say, hey, what is your priority action for this patient? Based on the signs and symptoms I've told you. He has hallucination, the delusion, cannot take care of himself, they are unkept, and they have all the features associated with the schizophrenia. What will you do for this patient? What would you do? What would be your plan of care for this patient? List your plan of care that you think NCLEX will give you a table and say which of these is indicated, right? I'll tell you, we got to admit the patient. Patient has to be admitted, right? Patient has to be admitted to the hospital based on they cannot take care of themselves. This patient, whether they like it or not, they will be admitted to the hospital. Then what? They will need IV fluid. Why do they need IV fluid? This is very key when it comes to mental health psych issue in the NCLEX in the test. There's one thing you have to worry about. Number one is the most important when these patients get admitted. That is your priority. And we call it what? Why do we give this patient IV fluid? Why? If you're taking the test, they may not use IV fluid, but they may give you something else. If you know it, you can put it in the comments. But why do the patient need IV fluid? It's because we have to provide their physical need before we provide their psychological need. So these patients need physical needs, and which are what? IV fluid. Make sure you shave them, you give them new clothes, you take care of them. Before then, you manage their hallucination, and then they go to group therapy negative. You usually, it's a trap. When you see group therapy on the NCLEX, don't pick it. Just pick one-on-one therapy between you and the patient. So I'm giving you crash course on mental health schizophrenia, easy way in the case form so that you can know when you see a question, those are the things they will ask you. So one-to-one, not the group therapy. Don't take the patient to the group therapy because they're not ready. This is diagnosis of schizophrenia, and your priority is to provide a physical need rather than the psychological need. Now, we got to at least treat this patient, right? I did a video on mental health, psych medication. You should watch it. He has all the medications that you need for your NCLEX and nursing school. But this patient is a schizophrenia. What medication will you give him? First generation or second generation? And give me examples so that I can type it. Give me examples of kind of medications you can give them for the situation. Yeah, psychosis, any antipsychotic, right? But you have to know some of the names. There's a bunch of them. There's a first, second, and a third generation antipsychotic. At least you got to know a few of them. And I encourage you to watch those videos on that mental health. I will link you to this video to watch it on the pharmacology. But what type of medication? Give me an example of mental health medication. Antipsychotic, first generation, that this patient may probably, we can give it to them. First or second generation, whatever you want to choose is acceptable. But you got to be ready to take care of the patient when they have side effects. So what example would you give? Example of first generation and a second generation antipsychotic. I'll choose one. I choose olanzapine. What kind of antipsychotic? Is he a first generation or second generation? I choose olanzapine. Is he a second generation or a first generation? What do you think? Is this a first one or second generation? This is a second generation antipsychotic. It looked like a clozapine. It's in the same group of clozapine. All the antipsychotic have their own side effect, but most of them will cause anticholinergic effect that's general. Antihistamine side effect is the same. They have sexual dysfunction is the same. There's general side effects you should try to know, like orthostatic hypertension, hypersecretion, urine output issue due to anticholinergic effect, but they have specific side effect. For this one, this is what happened. 3 months later, this is what the patient present. He came in, his glucose is 200, right? He has gained about 10 pounds, and his cholesterol is 150. So what do you think is the biggest side effect of olanzapine? Weight gain, right? Weight gain is the biggest side effect. Weight gain and cholesterol and diabetes problem is the biggest. So they gain weight, and therefore this patient is not happy. Is this patient happy? It's not. You think he's going to be happy? No. I've gained 10 pounds. My glucose is 200, and I have a cholesterol of 150. I'm not going to be happy. So this is what they've given you. What would you do? The glucose is too high. If I have to choose one medication between this, metformin and glipizide, which one would you choose? But you choose your answer choice based on the patient physical exams, right? Or the lab work. The glucose is 200, right? And then again, 10 pounds and the cholesterol is that high. If you have to choose one medication between glipizide and metformin, what would you choose? But you have to use the side effect of the medication. Endocrine video that I made, I talk about it, the endocrine pharmacology, metformin is one of them. Glipizide is a sulfur drug. But which one will you give to a patient who has gained 10 pounds, his glucose is 200, cholesterol is high? Which medication will you give? Which one do you think is the best one? You can give it to them. It's based on the side effects, like I told you, and the signs and symptoms of the patient. A glucose of 200, right, and weight gain is the problem. The weight gain is the problem. You want to choose anything that does not cause weight gain. Glipizide will stimulate the pancreas to release insulin, and that can lead to what? Weight gain. In this situation, we don't want any more weight gain. We want something that will not cause weight gain. So we're going to choose metformin. Metformin is the best one because it does not cause weight gain. So the patient came back after being on metformin for a couple of weeks. He came back, he has abdominal pain, he needs CT scan. What is the most important thing about this patient now? He's taking metformin, now he has abdominal pain, he needs CT scan. What if you have to do one thing? The most prioritized information you will do for this patient is what? Or what kind of teaching or what kind of order you expect the doctor to give you for a patient who we came into the emergency room with abdominal pain. What are you going to do? This concept is based on what? Metformin. I'm trying to link systems to systems so you can see. We start with the what? Mental health. Now we're talking about endocrine. Now we're talking about fundamentals of metformin in terms of pharmacology. What do you think? The major side effect of metformin is what? Lactic acidosis. And if it's lactic acidosis, well, if I'm going to give you contrast for a CT scan, you have to hold it. If they're already taking it, then we will need to give them fluid. Then we need to hold it for what? 42 hours after the CT scan before we can start it. That is the most important things you should do for this patient. Are you getting the story? So this is the case we're walking through. Like I said, we're going through the case. Now, the patient follow-up, what? A couple of months later, remember we give the patient what? Olanzapine. Now he's complaining about what? Inner feeling of restlessness. And he can't stay still. What is going on with this patient? He's been taking olanzapine. He's suffering from inner feeling of restlessness. He's not happy. And he can't stay still. What are you going to do for him? What do you think is going on? And how are you going to treat it? He's on olanzapine, don't forget. And olanzapine and metformin. What do you think is causing him to have restlessness, inner feeling of restlessness, and he can't stay still? First of all, you got to diagnose the problem. What is inner feeling of restlessness? And you can't stay still. This is extrapyramidal symptoms, one of them, and that is what? Akathisia, right? I call it adapt because the A is akathisia, or you can say the A is acute and the D is dystonia. That's number one. Another A is akathisia. The P is Parkinsonism. They look like somebody who have Parkinson disease. And the T, they have tardive dyskinesia. So this patient is having extrapyramidal symptoms. Specifically, this is akathisia because I can't stay still. The diagnosis is akathisia, but if you see extrapyramidal side effects, I'll pick that. So to recap, olanzapine can cause EPS. It can cause NMS. These signs and symptoms is EPS. And so these medication, we can treat it or change the medication and lower it. So we have to treat it. What kind of medication can we use to treat the symptoms of akathisia? That is something you also have to know. And you should watch the psych medication that I did, and this is related to that, right? Akathisia, if you have inner feeling of restlessness, what is going on? You can't stay still. There's a lot of anxiety. Everything is going up. The way to understand how you can treat it without not memorizing it, number one, you got to calm them down. What medication I can give you to calm you down? What do you think? What medication I can give to you to calm you down? Benzodiazepine. They can get benzodiazepine, will calm them down, or propranolol. But then after that, you give them the medication that can treat the akathisia itself, and that is benztropine or anticholinergic, right? You can give them anticholinergic. Diphenhydramine can do that. So this is the management of akathisia, EPS. You got it, right? Now, this patient, we check their lab work again. We got this. Is this good? HDL is 35. LDL is 200. Cholesterol is 350. Triglyceride is 150. You see, we're back to what? Cardiac. Cardiac pharmacology is what we're leading into. If you see this lipid profile, do you think this is good? Think about it. We have a HDL of 35, LDL of 200, cholesterol of 350, triglycerides 150. You already know this is abnormal, right? The HDL is too low, at least greater than 45. LDL is too high. At least we want it to be less than 100. Yeah, cholesterol is too high. We want it to be less than 200. Triglyceride is borderline. Therefore, what are you going to do? What do you think the doctor is going to order? What medication would the doctor give? Or would the doctor tell them to go exercise and lose weight? These numbers are too high. So if you want to treat it, most likely we need pharmacology. What medication do you expect? And what that medication, if you give it to the patient, what nursing instruction would you provide? Pharmacology, cardiac pharmacology is right here, right? What do you think this patient is going to get based on this lab work? If you know the answer, you can put it in. But this patient is going to get what? Statins. Whichever you want to pick is fair game. But you have to know what to tell the patient. What are priority nurse teaching for a patient on statin? What do you expect if they give you selected apply? You provide the teaching to the patient. Which of the following you're going to intervene? It's the same answer choice. I'm telling you, if you know what you're going to teach them, if they put it in the selected apply or they put it in the table form and they said tell the which one is indicated, you're going to pick the answer. Synthesize the content, put it together. Don't isolate each other. This is the same thing you see isolate. So what are you going to tell this patient? I'm going to give you this. We're going to give them statin. Now, what next action are you going to provide? First, number one, well, you got to take it at night because cholesterol, usually we make it what? At night. Two, what are you going to do? You tell them about risk factors, right? One, you should avoid grapefruit juice, right? Two, what? If when you're pregnant, you got to stop taking it. But the number one, the most important thing you should tell them is what? The most important thing taking statin is what? The most important thing if they're taking statin is what? The priority next action is what? The most important is what? Report any muscle cramp. Any muscle, any dark urine, let me know because we're going to have bad problem associated with it. So you provided that teaching. The patient did not listen. He came back 4 weeks later. He has what? Dark urine, muscle cramp, and creatinine kinase of 10,000. What do you think he has developed? He came back 4 weeks later, dark urine, muscle cramp, creatinine kinase of 10,000. What has the patient developed? What is your diagnosis? And you can see he has developed muscle injury. We kill the muscle, and the muscle is causing problem to the body. This is what we call rhabdomyolysis. What kind of lab work do you expect? I want you to list the lab work you should expect. What lab work do you expect? And I may help you. I will list them here. Potassium, K. Magnesium, calcium, phosphorus, creatinine, BUN, myoglobin. Which direction would they go? Do they go up or down? So up or down, up or down. Magnesium, I'll take magnesium off. I'll just give you potassium, calcium, phosphorus, creatinine, BUN, myoglobin, and CK. Up and down. Tell me which direction they will go. Potassium, where would potassium go? Potassium goes up. Where will calcium go? Which direction will calcium go? Calcium go down. Phosphorus is going to go up. This lab work is good to know. Creatinine, where do you think your creatinine is going to go? Which direction will your creatinine go? Look at it. They're having dark urine. You don't have to even memorize it. Dark urine, creatinine goes up. BUN, if creatinine goes up, BUN goes down. Myoglobinuria, you're going to see it goes up. And creatinine kinase. Creatinine kinase is the protein in the muscle, also goes up. So what happened? This is the cell, the muscle cell. it die. The problem is you have more potassium inside the cell and you have calcium. When the cell dies, a lot of phosphorus come out and it chew the calcium, and calcium go down and you have more phosphorus. The muscle go to the kidney and it kill your kidney and your creatinine and BUN goes up. That's why myoglobin goes up and that. Based on that, what do you think you need to do to treat it? The treatment is straightforward, right? It's straightforward treatment when it comes to this problem. It's straightforward. Let me go back so that you can see the treatment well. The treatment is based on the lab work, right? We have what? Too much potassium. We'll treat the potassium. How do you treat the potassium? You give them what? Glucose and insulin. That's all. You give them K-acylate, right? Which is the sodium polyestyrene. And then they get calcium gluconate. That's all. Now, how do you treat the renal failure? What do you think? They get a bunch of IV fluid, followed by furosemide. I'm giving you the content related to Rhabdo. A bunch of IV fluid, then you flush them out. Furosemide. You got to bind the phosphorus. So you give them something to bind the phosphorus. And that is the treatment of what? Rhabdomyolysis. Where would this patient be? Where are you going to keep this patient? Where exactly will you keep this patient? Where would you treat this patient? This patient needs to be in the ICU. And that's the management of rhabdomyolysis. So we're almost done. We treat the hyperkalemia. A month later, 3 months later, patient has what? Vaginal spotting, pregnancy test positive, and he has right lower quadrant pain. What has happened to the patient? He cannot take a joke. 3 months later, patient came in, he said, hey, I'm having some vaginal spotting. You check for ECG, they have positive ECG, and then they have right lower quadrant pain. What is the diagnosis for this? Right lower quadrant pain, positive ECG, and a vaginal spotting. What is your diagnosis for this problem? What do you think? Put down your answer. Let me see. What do you think? Any female that is young coming with the right lower quadrant and then ECG positive and a vaginal spotting, this is diagnosis of what? Ectopic pregnancy. So this lady has ectopic pregnancy now. So that's your treatment. How would you treat this patient? This is a trap. How would you treat this patient? Don't tell me you give the methotrexate. Methotrexates are used for what? People with ectopic pregnancy without symptoms. There's no pain. There's no bleeding. That one stable, you get methotrexate. If you bleeding, you have pain, you go and have surgery. Somebody put appendicitis. This cannot be appendicitis because their ACG is positive and the vaginal spotting will rule out appendicitis. They're bleeding through the vagina. They are pregnancy tests. It can be appendicitis, but there's two things that will rule out. So this patient will go to surgery and will remove the ectopic pregnancy. She came back later. She's still pregnant. And when you do the ultrasound, you see some placenta over the cervical os. What do you think is going on? She's still pregnant, right? And when you did the ultrasound, you see the placenta is laying here like that. What is your diagnosis? What is your diagnosis? I'm pregnant. I'm having bleeding. It's painless. I did the ultrasound and it's laying over the cervical os. What do you think? This is what we call what? Placenta previa. This is your prayer. I'm giving you buzzwords. When you hear it, if you know these little words, when you see it in a case, no, boom, boom, it comes to you like, oh, it pop out like a candy, like I say. those diagnoses will pop out like, oh, I know what is painless bleeding, pregnant, and the ultrasound, I see cervical os, low laying. This is placenta previa right there. So we treat it. Now, I want you to distinguish between this, and then I say goodbye to you. How can you distinguish between previa, abruption, and a rupture? What do you think? Who is going to have tachycardia? Who is going to have loss of fetal station? Who is going to have emergency surgery? Who is going to have bleeding that is painful? And then who going to have painless bleeding? And then which patient is going to have deceleration or which? So this is the table. This should say painful. So which one? I can tell you, everybody is bleeding. You should have some form of tachycardia. Previa doesn't have it too much, but at least it's a bleeding. So we assume they're going to have tachycardia. The diagnosis of uterine rupture is this, loss of fetal station. So this goes here. Who is going to need emergency C-section? Emergency C-section or surgery, abruption, and a uterine rupture. Previa is going to be admitted. They don't need anything. They have to be monitored. We check their blood, rest, vaginal rest. Who is going to have painful bleeding? Is that guy. Abruption and a uterine rupture. Which one is going to have painless bleeding? Previa. And which one is going to have deceleration in the baby? Baby is not going to be happy at all. I can tell you it's not previa, it's abruption and the uterine rupture. This is ADAPT NCLEX, NCLEX prep, NCLEX review, mastering case study in a walkthrough easy way so that you can understand putting system together.